of pain tolerance, I recommend you just put numbing cream. And there's a lot of different, there's like 2 or 3 products that you put them on topically about 2 hours before the procedure, and they really don't feel much. So it can be done. Oops, sorry. Next.
A lot of people on TV, their faces don't move at all. Is that Botox or worse?
Yeah, that's Botox.
Why would we want that?
I know you don't. I try to tell my patients, because I think some people become almost addicted to that. And I'm looking at these patients because I say, you know, they'll come back and they say, you know, I'm moving my lateral eyebrows. I said, you want to move your lateral eyebrows. You don't want to be completely frozen. So, you know, it depends, because some people, that's what they want. They want to stretch their whole forehead. They want no wrinkles. But I think, I agree with you. I think it's better to leave a little bit of movement and have them look a little bit more natural. Because, you know, with Botox, you can correct the anger look or the sad look, or, you know, just to improve and have people look a little bit better. You don't have to try to, you know, eliminate every single wrinkle, which is important.
You did mention silicone.
Mm-hmm. Silicone is being available again. You know, silicone was banned years ago when the whole issue about you know, that it was filtering from the you know, the breast implants, and there was this whole syndrome, people getting rheumatological disorders and arthritis and everything. And now it's back on the market. They have a more purified grade. Silicone appears to be permanent. And it's a filler agent that's available. It will be available, and it's gaining popularity again. The problem is that, you know, being permanent, if it doesn't look good, you're stuck with the results, kind of. You know, the beauty about all these other procedures is that they are, you know, you can play with them a little bit more.
You said that the Botox lasts around 6 months. Now, when it goes, does it take you back to where you were before you had it? Does it make it worse, or is it the general gradual aging process that you would have had?
No, that's a good question. What we're seeing is, and the studies are just being completed as we speak. More and more studies are being done, and what we're seeing is that after you do it 2 or 3 times, you lose the habit. Like if you frown a lot and you have a really strong muscle, the muscle kind of weakens, and after time and time you lose the habit, so you require less and less, and you stretch out the sessions less and less. So it's actually a good thing if you think about it that way, that people, instead of coming, you know, 3 times a year, are now coming twice a year or once a year, and it's a good point.
None of these things are for, like, I
no.
lost weight here. This is just surgery.
Yeah, that you'll need surgery, yeah.
Is there anything behind the fact when you have a microdermabrasion and a glycolic peel, like 1 week one and the second week?
No, I actually like to do it that way, because what you're doing is different. With the peel is penetrating, and we know there's some science out there, some studies that have shown that glycolic acid actually plumps the collagen a little bit, and it also exfoliates the skin. And the microdermabrasion, it's a more mechanical abrasion, so they work differently. One works deeper, one works more superficial. So what I like to do, I like to alternate it. You'll get a peel 1 week and then wait 2 weeks and then maybe do a microdermabrasion and alternate it, and ultimately you'll get better results.
Would you say a couple weeks?
2 weeks in between, yeah. Yeah. Well, thank you very much. Thank you for your attention.
Next, we're going to have the speakers from the Mind-Body Center for Integrative Medicine of Boca Raton Community Hospital, and we're going to have Christine Driscoll, the director, to give us a little bit of an overview on what this talk is all about and to introduce our next speakers. Thank you.
I am Christine Driscoll, and I am the director of the John Henry Center for Integrative Medicine, which is on Clintmore Road. I'll do a quick advertisement, which is off Military near Yamata for those of you who haven't visited us. I came up here and I came in today really excited and ready to go for tonight's presentation, but after sitting there and being a former lifeguard for 5 years, I think I'll be in your office tomorrow and I'll offer myself as a test case to see what can be done. So I'll come back in a month and we'll do another presentation, all right? Is that a deal? However, in talking about the John Henry Center this evening, how we fit into this presentation is the John Henry Center for Integrative Medicine is based upon a philosophy of self-care. In our work with the Mind Body Medical Institute, we have learned through research the concept that self-care, healing, comes from within.